Namaskar, I'm your host �W𝐚 here for the special series for Diabetes Par Charcha, which is happening at the Geo Convention Center, Mumbai. We have a renowned doctor here, Dr. 𝐌𝐫𝐢𝐠𝐚 𝐁𝐵𝐚, who is a diabetologist. Welcome, doctor. Welcome to our show. So could you please introduce yourself?
Yeah, I'm Dr. 𝐌𝐫𝐢𝐠𝐚 𝐁𝐵𝐚. I am from Assam, from Dibrugarh. I am a diabetologist and internist. I used to practice diabetes for last 18 years.
All right, wonderful, doctor. My first question to you is, what is the role of insulin in the management of diabetes?
Yeah, that is a very important question that you have asked me. The insulin is the most important when the insulin is not secreted in the body, or if the insulin is not produced properly, or if the insulin resistance develops, then people used to suffer from diabetes. There are many types of diabetes, probably you people know, the type 1, type 2, and others, and gestational diabetes mellitus. When the people is required the insulin, that means if the sugar level is more, not controlled with the drugs, not controlled with the lifestyle modification, in that category, we require the insulin. Nowadays, the concept of insulin has been changed. It has been more scientific one. And earlier what happened, we used to give mainly the human insulin we used to give. Nowadays, the ultra-short acting, designer, long-acting, and different types of the insulin is to be given. Now, what the people is to think, the main thing is that people is to think that once this insulin is started, that means for the rest of the life, it should be taken insulin regularly. The concept has been revolutionized and changing. That means if your sugar level is very high, that means you require insulin. And whenever sugar level is less and is controlled with medication or insulin, and after the withdrawing of the insulin, if the sugar level is controlled, then insulin can be withdrawn. That is not that like that once insulin is started, that means insulin has been started for whole of the life. Probably if I go to the main molecule of the insulin is nothing, it is one type of the proteins. Total numbers of the amino acids is 51. A and B chain is there, 21 and 30 amino acid, and both the amino acid chains are connected with the covalent bonds. It is mainly secreted from the pancreas. There is some endocrine cells is named, that is the beta cells which secrete the insulin. Wherever the blood sugar level increase in the body, immediately the signal goes to the pancreas and beta cells, and they have given and they have secreted the insulin. Sometimes there is no insulin secretion, that is found in the type 1 diabetes, and sometimes insulin is secreted but not adequately, or insulin secreted more but it has no function on sugar level. That is called insulin resistance. That is mainly found in the type 2 diabetes. And mainly in the time of the gestational diabetes, just I want to inform you that in the time of the pregnancy, if anybody having the sugar level is high, in that category, we should start the insulin base for the betterment of the mother as well as the fetus. That is the main part. Insulin, very shortly I am telling, because insulin is a brake chapter. When the insulin was started, when it was invented, all the members who were doing the exercise on insulin, they got the Nobel Prize.
This is enormous of knowledge, I guess, doctor. And I have one more question to you. Well, do all the diabetic patients require insulin?
No, that's the concept is again changing. I want to just in the first topic, in the first of questions, I have already input to you that all the patient does not require the insulin. Once the insulin is started, that means whole of the life insulin is not required. If we see the patient having high blood sugar level, that if it is literally it is more than 250, then insulin is required. If the sugar level is less than 250, and if the fasting is more than 100 and PP is more than 200 but is less than 250, then we can start the medication. There's a lots of the therapy for the diabetes control. First one is the lifestyle modification. Second is the drugs monotherapy. Third one is the monotherapy plus add-on therapy, the 2 drugs. Then 2 drugs plus another add-on therapy, 3 drugs. Then not control, then you go for the insulin. But in any case of the surgery, apart from the cataract surgery, in any form of the surgery, always insulin is the preferred drug that should be given during the time of the intraoperative period, pre-operative period, and post-operative period. Insulin is must. I request again all the people who are hearing my voice, please don't be very, very afraid of taking the insulin, because insulin is a very good drug. In your home, there is no rice, there is no roti. That means you should buy from the roti and rice from the outside. Just like in your body, no insulin, you should take the insulin from the outside. That is the simple concept. And once it is started, you should not think that it should be given for the whole life. It should be given only for the temporary. Sometimes it may require for the whole life, sometimes it may not. But insulin you should not be afraid about the insulin. And I have a huge experience on that part, 18 years experience I have using the insulin properly. I know it's in every corner, but yet to know many things. But even though I can give you assurance that insulin is not a bad one, you can start that and it can be started. You should do the physical exercise along with the insulin therapy, along with the drugs, and definitely you should be okay. And our motto is to control the sugar level at any cost, because India is considered to be the capital of the diabetes, and India secured the second largest infected person in the world. That is the most dreaded and most disadvantaged for us. That's why at any cost, we should control ourselves, we should control to others, and we should aware ourselves amongst the diabetes along with the insulin therapy.
Thank you for the valuable message, Doctor. It was quite elaborate. And I feel like, the viewers will definitely benefit out of this. Thank you very much.
Thank you.
We're very happy to have you here. Thank you.
Thank you.
To know more about the diabetes and how to control diabetes, please follow our page, Diabetes Per Charsha, which is in the Facebook. And we're also available in YouTube, Twitter, and Instagram. Thank you.
Thank you.